Hey, what's going on? Dr. Taylor, Aspire Chiropractic. One of the coolest things that I get to do in my job here as a chiropractor is I get to stop people from having surgery. No, I get to save people from having surgery. Hell, that's way better. This here, what we're going to talk about today, is one of the most common ways that I stop people getting cut open, okay? So we're going to talk about something called Pronator Teres Syndrome, okay? Now, Pronator Teres Syndrome is typically missed. Not even misdiagnosed, it's just flat out missed because it looks a lot like, if not exactly like, carpal tunnel. So what is carpal tunnel, right? Who gets carpal tunnel? Carpal tunnel happens with people who work on keyboards a lot, people who do mouse things, people who do things with their hands routinely, right? And what happens, they get this numbness and tingling in their hands, they get a pain or a burning sensation in their wrists, and what do? They go in, they get cut open, and it doesn't go away, it doesn't fix it. So let's talk about it, right? We're going to look at our hand. Here's dot, 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 dot. 1, 2, 3, 4, 5. Sweet, got it. First try. There's our hand, okay? So we're going to be looking at this part right here. So what I'm going to do, I'm going to take this thing, we're looking at it like this, I'm going to turn it so the fingers are going right into the board, and I'm going to cut the hand off. So right here, we're looking into the wrist. Now, our wrist, actually, no, let's go back here. We're going to look at this again. Our wrist is made up of 8 bones called carpals, right? And all they are, they're just 2 rows of 4. 1, 2, 3, 4. Just kind of stacked right next to each other. They don't fit very well. You can feel it just roll around in your wrist, right? But what happens is, if we take this thing, now we're looking at it, fingers into the board, we're going to look at 1, 2, 3, 4. So these are your carpal bones, and they make up the carpal tunnel, okay? And then on this side, so this is the bottom, this is the palm side. Here's the back of your hand right up here. Because again, we're looking at it like this. In here is everything that has to go into your arms, hands, and fingers. These are all of the tendons that go through there, right? These are all of the nerves that go in there. So you can touch and feel and sense things. These are all of the blood vessels that go through there. And these are all of the muscles that are in and around your wrist. It's an incredibly tiny place. So the carpal bones that create the carpal tunnel, you see they got to arch in it. They got to arch in it just like your foot does. But what happens is through prolonged extension, right? Typing, driving, I don't know, screwing, with a screwdriver, these bones can fall into that carpal tunnel and put pressure on the stuff that's in there. Now, if we put pressure on a tendon or a ligament, not a huge deal, really. If we put pressure on a blood vessel, then we might look at people that, like, their palms are really white. If we put pressure on a nerve, then we start to lose feeling and sensation, and that's where things get important. Because on the other side of this, it's not just skin that holds this together. There's a swath of tissue here called your flexor retinaculum. Basically, it's just a ligament, but it keeps the bottom side of that thing together. So the surgical intervention, if you will, the surgical butchering, is they cut that thing. They just go in there, they slit your wrists, they cut that piece, and then they'll give it more room. But here's the issue. Carpal tunnel syndrome, pressure on the nerve causing numbness, tingling, immobility, movement, muscle weakness in the hand because of pressure on those nerves right there. So if this gets inflamed, that bone drops down, causes the pressure, they go in, they slit your wrists, they cut that piece of tissue, and they sew you back up, and they cross their fingers. Here's the crappy part. These nerves here, specifically the median nerve, there's a whole bunch of places that thing can get pinched. And the most common place is not even in the freaking hand, it's in the forearm. So, we're going to look at your arm from the side, okay? Thumb, 1, 2, 3, 4. Here's all those wrist bones we were talking about. There's your elbow, okay? So, there we go. So we're all on the same page. There's a bone, there's a bone. Now, there's a bunch of nerves that come down the arm. We're going to draw just one, the important one. This is going to be the median nerve. It goes right down the middle like that. And we're going to say it's this guy right here. It goes right through there. So that median nerve gets pinched in legitimate carpal tunnel and the surgery is a success, cool. But if the surgery is a failure, here's why. Here's why it's missed. Here's why carpal tunnel is misdiagnosed or improperly diagnosed. There's a big fat muscle right here, right in the middle of your forearm. Now muscles only pull, right? Your bicep pulls, your tricep pulls. If we've got two bones in our arm, one right there and one right there, and a muscle that goes from one bone to the other, if that thing pulls, what's it going to do? It's going to roll your hand over. So, keyboard issue causes carpal tunnel. Do we use keyboards like this? No, this is very suggestive. We use them like this. So that muscle is short. So then what happens? Go like this. Here's that bottom bone. Here's that top bone. Because again, our hands are over like this. And then that muscle there gets short and tight and fat. And when it's short and tight and fat, because it's just contracted, right? Bicep contracts, see? Bloop. Tricep contracts, the muscle gets bigger, presses on that nerve. So if we press on that nerve here in the forearm or here in the hand, are the symptoms going to change? No, because we're putting pressure, issue, disease, dysfunction on the same nerve that carries the same signals. So if you've got pressure here, that's going to cause numbness and tingling in the hand there. And then you go to your MD and say, I got numbness and tingling in my hand. They go, okay, cool, you got carpal tunnel. We're going to slice your wrists. We're going to cut that open right there. You come back later, hey, I've got a nasty scar here and I've still got carpal tunnel. The surgery didn't work. Well, no, the surgery worked fine. You weren't fixing something, though. You weren't fixing carpal tunnel. You were attempting to fix Pronator Teres Syndrome. So, how do we fix it without getting sliced open? Super easy. You assess the elbow, make sure the joints here and here are working right. You assess the bones in the wrist, make sure those are working right. The reason being, because we've also got plenty of other muscles that go from the forearm in here, because if we've got issue here or issue here, those bones aren't going to work right. And then you go after this muscle there. You go after that pronator teres, you strip it out, you find a massage therapist, or shoot, I don't know, your own thumb, and just work that thing out. And you'll feel numbness and tingling in your hands and fingers. Heck, you're going to hit some trigger points that are going to make you flip yourself off. But then you're going to take the pressure off that nerve. And you're going to feel it in your hand. And you're not going to have a nasty scar where some surgeon slit your wrist open. And your hand's going to work again. Why? Because you went to a chiropractor. You didn't go to an MD. You didn't go to a surgeon. You went to somebody who listens to your symptom, but then checks the whole body, not just where the symptom is. So right here at Aspire Chiropractic, we do these things. We do the whole assessment. We check the whole person, and we're ready to help you when you're ready to be your best, naturally, without slitting your wrists.